Hi, this is Christine from Badlands Healing Yoga. I'm glad you're here. This video will be on how glute training and glut medius training specifically can really help with knees, hips, and low backs. So if you have foam rolled the snot out of your IT bands, or you just know you have super tight ones and nothing seems to help, or if your knees come in a bit, either when you're squatting they sort of fall in, or just standing you notice that they tend to come toward each other. If you have hip pain, either anterior hip pain, so in the front, along the back somewhere, or a little higher in the low back, sometimes the glut medius is implicated. Yoga has a number of postures that are specifically targeting the glut medius if we do them with the appropriate form. So this is also going to help to explain some of the common cues you hear that you might not understand why your yoga teacher thinks they're so important. So the glut medius, its whole purpose is to stabilize the pelvis, ABduct the femurs, so out to the side. I went back there to avoid the block. ABduct, this is AD or adduction, abduction, adduction, and then internal rotation. And they function a little in external rotation as well. Your glute max is sort of the lower 2/3 of your gluteal muscles, and they're explosive and more propulsive. You also have a glute minimus that's deep, and it's very much a postural muscle. Your glute medius is really, it originates on the upper 2/3 of the back of your pelvis, or sorry, upper 1/3, and then it attaches to this sticky outy bone here, called a trochanter. A trochanter is a protuberance on the bone where things attach, and your trochanter is often considered part of the hip joint itself. So it goes from the set toward the center, starts on either side of the sacrum, and originates across the top and then attaches back here. So you can see how it might be able to do this and this. So that's why it's important and how it can help you. Places where yoga is targeting this muscle. All of our side-facing poses. So you might be able to just imagine, and if you want to do this with me, moving from mountain and then projecting, say, the right leg back and opening your hips to the long edge of the mat. Now, your teacher might have said over and over again, right? Knee up toward the little toe side of the foot. Now, what we're not meaning to roll onto the outside of the foot, right? There's a balance between pressing into the ball mound of the big toe. What we want is that knee to be centered, and the reason it's important is that this is a really common pattern to see at the beginning. So I often say, imagine you have a string on the upper outer third, and you're going to draw it back. And then you're going to be centered over that knee. At the same time, you're going to press onto the outside of the back foot, and that's going to engage the back one as well. And then, of course, in warrior two, our arms floating up. So warrior two, triumphant warrior, or reverse warrior, reverse triangle. Now notice, so what often will happen as you straighten that front leg, you'll be centered here, glute medius engaged, and then you just lose it and the knee turns in as you straighten. So try to imagine having it engaged here, try to practice engaging, keeping it engaged as you come back, and you're going to feel a difference in your triangle pose. Same with Parshvakonasana, side angle pose. So, and you can feel its stabilizing effect as you step forward. Another place where we're meant to be engaging it, but often our prior habit patterns take over and we avoid engaging it, is in recalcitrant, tree pose from last week, right? So this outer turn is often neglected. So you often will see people here or part of the way out. Over time, you want to think about drawing that knee back, whether you're at the calf or the inner thigh. It is going to help to stabilize you. One way of training this is to get up close to a wall. And I'm going to do it turned a little bit away. You would do it standing directly sideways. Now, I often have people do this because what you're going to want to do is reach out and touch the wall. Instead, go like this. Get close enough, and there's a little bit of a Goldilocks thing going on here. So take your time. See, and I didn't touch the wall, so I'm going to get a little closer. Push your knee into the wall. And then, of course, you can do whatever you like with your arms. Now, of course, you're going to be much more side like this and pushing back. But I wanted you to be able to see it from a front aspect first. So that's another yoga way of feeling. So first we sense, we feel the structure, that whether or not you know the name of the muscle in 30 seconds, don't worry about it. What you want to feel is that drawing back, hip points forward, drawing, but the femur drawing back. Another place that we're meant to be engaging the glute medius that often goes awry is bridge pose. Because our glute medius is the primary muscle, it's the one that we're mostly used to. If someone asks us to engage our glute, it's easy to go to there first, right? So you may have been in bridge pose and heard an instructor say, activate the inner thigh muscles. So it's easy for the feet to go out and the knees to knock outwards. If you engage the inner thigh muscles and then go to lift the hips, right? These are the opposite forces that we're containing in our awareness and in our body. And it's helpful, this is a reason that we often ask people to put a block, usually medium way, between the legs, squeeze into the block, and lift the hips. Now here, you can feel the equal and opposing forces that will be able to lift you up. Another fun one, the last one we'll do, is also a one-legged standing pose, and often taught with a block. So I like to teach it from Warrior 2. So you want to make sure, now you understand why it's so important to make sure that your knee is directly over your ankle as you're moving forward, right? Because that assures that you have the support for the stability you're going to need going forward. Often taught with a block in the first hand. Now, this lifting of the back leg is partially the glute medius, the stabilization of the front leg. Of course, I tried to look at you. So, the stabilization of the front leg is also glut medius. Often at first, as you're coming forward, those front toes will turn in. And I used to get very frustrated when my teacher would say, no, stop, go back, toes to the short edge of the mat, because then I would try coming forward, and it's more difficult. It's more difficult because you have to engage that glut medius to stabilize so that you have a point from which you can lift. Now, another pose that can train this is utkatasana, fierce pose. And there are some tricks that we can use, because the last part of this is that many people, women in particular, but many men in general as well, particularly men who have done track and field sports in the past, quad dominant, meaning quads try to take over instead of engaging glutes. There are some tips and tricks for overcoming that. Comment below if you'd like to know some of those. And please like and consider subscribing if this has been of any benefit to you, and share if you think it might benefit someone else that you know. I'm really glad you're here. Thanks, and Jai. Happy Yoga Day.